This is the Infection Control lecture for RAD 240 in Patient Care, and my name is Debbie Lamb, and I'll be your course instructor. This is probably going to be a review for everyone because infection control is actually something that we use and follow every day without even thinking about it. There are, however, 32 questions on the MRI registry that have to deal with patient care and patient care issues, and they may, in fact, ask an infection control question. So I just want everyone to be as prepared as possible. So let's begin by just giving a quick definition of exactly what an infection is. An infection is defined as the process by which germs enter a susceptible site in the body and multiply, resulting in disease. And because there is an increased contact between patients and healthcare workers, we all need to be aware of how an infection is acquired and what we can do to stop the spread of germs. Microorganisms that cause infections and disease are called pathogens. Pathogens have the ability to do one of three functions. They can multiply in large numbers and cause an obstruction. They can cause tissue damage, and they can secrete organic substances called exotoxins. And these exotoxins can produce certain side effects that we get when we get an infection, such as high body temperature, nausea, vomiting, or even shock. Pathogens are divided into four basic infectious agents, and they are bacteria, viruses, fungi, and protozoa. These are all outlined in much more great detail in your patient care book, so please take a few minutes to review them. Now, in order for an infection to spread from an infected person to a well person, there has to be a very precise series of events that occur. Think of the chain of infection as a chain with 6 links that all must be present and intact for the spread of an infectious disease to occur. And our goal as healthcare providers is to break one or more of these links in the chain so that obviously an infection doesn't spread. So let's go through each of these links individually. Let's first start with an infectious agent. Obviously we need an infectious agent such as the ones I just talked about: bacteria, fungi, a virus, some type of an infectious agent. And one way that we can break that chain is to identify these patients who have these infections very quickly and isolate them from other patients so that we can stop that spread of infection. The next link would be a reservoir. Obviously, an infectious organism needs someplace to live. It needs to be an environment that provides nutrients and that's of a suitable temperature. Reservoirs can actually be inanimate objects, such as maybe equipment that we use, food. Animals can be reservoirs, and people, us, healthcare workers, can actually become a reservoir for our immunocompromised patients. And a couple of ways that we can keep ourselves from becoming a reservoir is when we're sick, staying home, sanitizing objects that we use, equipment that we use, wiping it off clean. I know in MRI we're not using cassettes, but radiographers need to wipe cassettes off that they use, wipe off portable machines, wipe off our tabletops, the couches that our patients lay on. Disinfect, sterilize, and anything that we use, and also always wash our hands. The next link would be a portal of exit. The infectious disease needs a way to get out of the infected person so it can get onto the uninfected person, and this can happen through sneezing, through coughing, through blood, through body fluids, through a patient's secretions. So a couple of ways that we can stop that from happening is to control a patient's excretions and secretions by keeping their wounds covered. If they're coughing, putting a mask on them, removing trash and waste quickly, and obviously, again, hand washing. Next, the infectious agent needs a means of transportation, a way to travel, and this can be done through either direct contact, person to person, or through indirect contact, meaning physical contact with an object that has been in contact with an infected person, such as our gloves, like I said, radiographic equipment. These inanimate objects are actually called fomites. Also, infectious agents can travel on an insect, or we call that a vector, and a disease-carrying insect such as a mosquito or a tick. It can travel through the air in the form of dust or droplets, or it can be on food that's not prepared right, or that has not been refrigerated properly. So all of this can be a means of transmission of the infectious agent. Next, we need a portal of entry. We need a way for this organism to get into the uninfected person. And this can happen through a patient's mucous membranes in their nose, through broken skin, through the GI, or through the respiratory tract. One way that we can keep this link closed is by, again, wound care, covering wounds, catheter care, using aseptic technique, hand washing. All these are ways that we can keep an infectious agent from entering a patient. And finally, we need a susceptible host. We need someone with a weakened immune system, such as our patients, particularly maybe cancer patients, elderly patients, pediatric patients, patients that have recently had surgery or have a weakened immune system, patients that have been badly burned, even patients that have diabetes all have a weaker immune system than someone that does not. So again, keeping these patients, these high-risk patients, flagged so that we know who's at high risk, and treating their underlying diseases can help to stop the spread of infection. Our bodies actually have their own ways of fighting off infection. There's 3 different ways. Our bodies have a natural resistance, which means we have a natural way of keeping our bodies from developing infections. One of those is that our skin's intact. We have membranes in our nose and nostril hair in our nose to hopefully keep out any airborne particles. We have digestive enzymes that help provide a natural resistance to disease-producing organisms. We also have tears that secrete out of our eyes to help bathe our eyes, to keep our eyes clean, and urine, which helps to cleanse our urinary system. So our bodies have their own defenses against infection. There's also what's known as acquired immunity. Humans are actually born with a certain amount of immunity. Most humans actually become resistant to disease by actually becoming infected with a specific organism. For example, chickenpox. We become resistant to the chickenpox virus. Once we have it once, we can't get it again, obviously. There's also many types of vaccines that children get nowadays to help prevent them from getting diseases. Vaccinations are actually made from dead or weakened strains of the microorganism. So we have natural resistance, we have acquired immunity. There's also something called passive immunity. Passive immunity is the transfer of antibodies that were produced in one person transferred to another. And these usually last a few weeks to a few months. And one example is the immunity that's transferred from a mother to a child, possibly through breast milk, to help that child be immune to some certain infectious diseases. Now, there are a couple of types of infections that I would like to concentrate on a bit more than others, and 2 of these are nosocomial and iatrogenic infections. A nosocomial infection is an infection that a patient acquires while they are in the hospital. These infections may extend the length of a patient's stay. They could prolong their recovery time. Patients that are in critical care units are more susceptible to acquiring a nosocomial infection. So these are infections that patients acquire just because they are receiving medical care. It has nothing to do with why they are in the hospital. Maybe they came into the hospital to have their gallbladder taken out and they end up getting pneumonia. So that would be a nosocomial infection, an infection that a patient got while they were a patient in the hospital. Hospitals don't like nosocomial infections. They give the hospitals a bad reputation. They also increase a patient's stay, and unfortunately, approximately 5% of patients that are admitted to the hospital get some sort of nosocomial infection, and it actually ends up costing the hospital up and above around $50,000 additional dollars to help treat these patients. So nosocomial infections are those infections that are acquired while the patient is in the hospital. Now, an iatrogenic infection is a type of nosocomial infection, but it is actually the direct result from a procedure that the patient had. So suppose the patient has some type of abdominal surgery and then the patient ends up getting an infection in their incision. That would be iatrogenic infection because that is a direct result from a procedure that the patient had done. There's also a third type of infection that you may hear of, and that's called a community-acquired infection, and that's an infection that a patient has when they enter the hospital. So the patient already has an infection before they even enter the hospital that they acquired out in the community. So a couple of infections terms that I want you to be aware of. Now, when patients get a nosocomial infection, there's two types that are very important to us that I want to talk about. Two types of nosocomial infections are MRSA and VRE, and I'm sure you've heard of these. MRSA is methicillin-resistant Staphylococcus aureus, and VRE is vancomycin-resistant Enterococcus. And these are both dangerous types of infections. Vancomycin is probably the most potent antibiotic out there, that when someone has an infection, it's kind of a last resort drug that they use. So if someone is vancomycin resistant, that's very dangerous for them. So these are two types of infections that we want to be aware of. We also want to make sure these patients are red flagged so that we can take the proper precautions when we have to deal with a patient that has MRSA or VRE. And these again are outlined in much more great detail in your patient care book that you can take a look at. Now, MRSA has been a problem for us in the healthcare setting for like 20 years, but over the last several years, MRSA has also become a problem in the community, and we refer to that as community-acquired MRSA. And this form has occurred among otherwise healthy people. It's responsible for some serious skin and soft tissue infections and for a serious form of pneumonia. And those people that are more at risk for community-acquired MRSA are young people, people that participate in contact sports, people that share things like their athletic equipment, those with weakened immune systems, or people living in crowded or unsanitary conditions such as possibly a nursing home, jail, anywhere where there's a lot of people and the conditions are not very sanitary. What can you do to keep yourself from getting MRSA in the community? Keep your personal items personal. Don't share. Always keep your wounds covered. Shower frequently. Using antibiotics appropriately. That's a big one. A lot of times people take antibiotics unnecessarily, then they actually become immune to them, and then when you really need them when you're sick, they don't work. So you want to always make sure that you use antibiotics appropriately. Always want to hand wash. Use personal protective equipment when you're dealing with patients that have MRSA, and be sure that you use proper isolation techniques also when you're dealing with these patients that have these nosocomial infections. Some other concerns that we have as healthcare providers, HIV and AIDS. Again, I'm not going to spend a lot of time on this. We're all professionals. We all know how HIV and AIDS are acquired, obviously not through casual contact, but you as a healthcare provider are going to be coming in contact with patients that have HIV or AIDS, and we won't know about it because of confidentiality rules. It keeps us from being informed about all the diagnosed cases, and there are many, many cases that have not been diagnosed, so we always need to treat all patients as if they could possibly be potentially infected with HIV or AIDS. And I don't mean to go crazy and glove up and gown up for every patient, but obviously you need to use common sense and wear personal protective equipment when there's blood and body fluids involved. Actually, most healthcare workers that become infected with HIV are exposed as a result of activities that are actually unrelated to their work. But the biggest risk factor for healthcare providers is through accidental needle sticks. And these numbers have actually gone way down since most hospitals have gone to a new needleless system. The chances of having an accidental needle stick nowadays is very, very close to being zero. So we've really decreased the risks of unnecessary or accidental needle sticks through these new systems that we have. Hepatitis, another concern for healthcare workers. There are 5 types of hepatitis. There's A through E. B and C are actually the greatest concern for us as healthcare workers. There is a vaccine and a preventative therapy for B, which I recommend that most healthcare workers receive. Hepatitis actually is, all of these forms of hepatitis actually manifest in the same way. Patients typically become jaundiced, fatigued, have abdominal pain, loss of appetite, nausea, vomiting. Hepatitis B is a type that can move from one person to another through blood and body fluids. It can also be transmitted through sexual intercourse and through needles, such as those shared by intravenous drug or steroid users or who have the virus. A pregnant woman can also pass hepatitis B to her unborn baby. So I highly recommend that healthcare workers actually get the hepatitis vaccine. It is administered in a series of 3 injections, and then a titer can be drawn to make sure sufficient antibodies are present. So if you had hepatitis shots many years ago, you might want to get titers drawn to make sure that you still have those antibodies in you. If not, you may need to get a repeat of those 3 repeat series of hepatitis vaccinations. Okay, let's move on to what exactly aseptic technique is. As RTs, we all have the ability and the responsibility to prevent the spread of infectious organisms, and knowledge of the principles of sterilization and disinfection is definitely something that we need to know. Asepsis actually means freedom from infection, and it can be divided into 2 categories: medical asepsis and surgical asepsis. Medical asepsis is also called the clean technique, and it incorporates basic principles of hygiene that are practiced at home. Surgical asepsis is also called sterile techniques because it eliminates pathogens by sterilization. Aseptic technique is most strictly applied in the operating room because direct and often extensive disruption of the skin and underlying tissue is involved in the operating room. Aseptic technique also helps to prevent or minimize any kind of post-operative infections. So as far as medical asepsis goes, basically we just need to use common sense. We need to hand wash when necessary, clean our areas, change linens, wipe off our equipment. Most equipment needs to be cleaned with a hospital-approved disinfectant. Sometimes during outbreaks of GI illnesses, hospitals may go to a bleach solution for cleaning. A couple of things that we can do as healthcare providers is when we're sick, cover our nose and mouth with either a tissue or a shirt sleeve, wear clean uniforms daily, wash our hands frequently, and just using common sense basically is what medical asepsis is. Sterilization is more for surgical asepsis. Sterilization is defined as the absolute killing of all life forms. There's a couple different ways that things are sterilized in a hospital setting. There's chemical sterilization, which actually soaks objects in a bath of germicidal solution followed by a sterile water rinse. There's dry heat, such as an oven used to sterilize sharp instruments. There's gas, which items that can be damaged by high temperatures are sterilized with a mixture of gases, primarily for electrical, plastic, or rubber items. And then there's autoclaving, which most people are most familiar with, and that's moist heat, steam sterilization, which is the most common sterilization method. It's the quickest and most convenient means of sterilization, and that really can only be used for items that can withstand heat and moisture. So just a couple of ways that things are sterilized in the hospital setting. Sometimes in radiology, I'm not sure how often this would happen in MRI, but you may be involved in a procedure that involves a puncture or an incision of the skin and requires a skin prep to prevent pathogens from entering the body. I'm sure all of you have done this before, prep the skin for some kind of procedure. But just to go over the steps involved, you would remove all the hair with a razor. You would clean with antiseptics, sometimes a betadine solution, maybe a facility uses something else. You would do that in a circular motion from the inside to the out, and you would do this 3 times with a clean sponge each time. So that's to prep a patient for some kind of invasive procedure. Okay, let's move on and talk about what standard precautions are. Standard precautions should be used when performing procedures that may require contact with blood, body fluids, secretions, mucous membranes, and non-intact skin. Also included in this category are many items which may be soiled or contaminated with any of these substances. All patients should be regarded as potentially infectious. You cannot tell if a person is infected with a bloodborne disease just by their appearance. So you should apply standard precautions to all patients regardless of diagnosis and infectious status. And again, that doesn't mean that every patient you need to wear a gown and gloves. You need to use common sense. If there are blood and body fluids involved, obviously you need to wear gloves. Standard precautions has also been known as universal precautions. Now, standard precautions have been divided into two tiers. Tier 1 is basically standard precautions which we use on every patient. This means every patient that we come in contact with could potentially have an infectious disease, so we need to use common sense and use personal protective equipment when necessary. Tier 2 is for those patients who we need more protection against. They're suspected of having some kind of communicable disease, so we need to use a bit more precautions than just the regular standard precautions. And we're going to go over each of these individually. Standard precautions would include hand washing, gloves when necessary, personal protective equipment, meaning if you're involved in a procedure that there may be splashing of any kind of fluids, you would want to wear eye protective gear, goggles. So standard precautions is basically just common sense with every patient that you come in contact with. I'm not going to go over with you how to wash your hands. I'm hoping that you already know how to do this. Some people obviously too quickly wash their hands and don't get all of the germs off, but you need to make sure that you, lather up and count to at least 15 when you're washing your hands, and then rinse real well, and then obviously turn the tap or the spigot off with your sleeve or with a paper towel. Gloves should always be worn when touching blood, body fluids, any kind of secretions or excretions, or any kind of contaminated objects. You should always wear gloves. Gloves should be changed between patients, and when you remove your gloves, you should promptly wash your hands. Common sense stuff. Personal protective equipment, like I said, gloves, gowns, eyewear, face shields, hairnet, shoe coverings, depending on what kind of procedure you're involved with, will depend on what kind of personal protective equipment you need to use. But if you're involved in something that could result in some kind of splash of some kind of body fluid, you need to protect your mucous membranes of your nose and your mouth and your eyes during procedures. And you also want to protect your clothing with a gown to prevent soiling of your clothing during a procedure. So, like I said, common sense stuff. Personal protective equipment needs to be used when necessary, when you feel like blood or body fluids could come in contact with you. Now, transmission-based precautions are those tier 2 precautions that I talked about, and these are precautions that are applied whenever a patient is infected with a pathogenic organism or a communicable disease. Transmission-based precautions must be applied when a patient is at risk of becoming infected, such as those who are immunosuppressed. You want to always check the posters on the patient's doors to see if they're on any kind of precautions. Typically, precautions are divided into 3 categories: airborne, droplet, or contact precautions. If there are precautions listed on a patient's door to their room, you want to check with the patient's nurse to assure that you are protecting yourself appropriately. Isolation techniques have been, like I said, combined into 3 sets of guidelines. First, there's airborne. Airborne precautions are designed to reduce the risk of transmitting dust particles containing infectious organisms. Healthcare workers and visitors entering the room must wear approved masks. So everyone at this point in their career, I'm sure, has been fit tested for an N95 mask. These masks are worn to help filter out very small particles And you need to make sure that your mask fits properly. If it doesn't, then it's not doing you any good. So everyone should have been fit tested and to know what size N95 mask that you should be wearing. So anytime a patient is on airborne precautions, you should have a mask on when you enter that patient's room. Droplet precautions are precautions designed to reduce the risk of larger droplet transmission. These droplets are very big, so you don't need the N95 mask. Just a regular surgical mask will do the trick to help protect you against these larger droplets. These pathogens expelled from the patient, these pathogens can be expelled from a patient during coughing, sneezing, or even talking. The pathogens infect another person through contact with the droplet transmission involved. So we need to make sure that we are covering our nose and our mouth with at least a surgical mask. I mean, you could wear N95, but it's not necessary with these patients. Droplets that are generated from the source person primarily through coughing, sneezing, or talking, usually during certain procedures such as a bronchoscopy or when a patient's being suctioned. So you want to make sure that if patients are on droplet precautions that you protect yourself. Some types of droplet precautions may be patients who have influenza, mumps, rubella, some types of meningitis. So like I said, just a regular surgical mask will protect you because these droplets do not remain suspended in the air. Patients don't need to be in any kind of special room, and they don't need any kind of special air circulation. Just a surgical mask will protect you just fine. Contact precautions are precautions that are used when caring for a patient with a pathogen that spreads by direct contact with the patient or by indirect contact with a contaminated object, such as the patient's dressings or bed rail. Indirect contact is through a person has touched or came in contact with the contaminated object. Direct contact would be a person actually touches the person who is infected. So we as healthcare workers, if someone is on contact precautions, we need to make sure that we wear gloves and a gown and possibly a mask. Sometimes these patients should be housed in a private room with another patient who is either infected with the same disease, or they should be in a isolated room by themselves. Healthcare workers, like I said, should wear gloves if they're going to be coming in contact with these patients. If the patient comes to the MRI department, they should be wearing a mask, a gown, a mask and gown, and staff should be notified before receiving the patient. So you should make sure that if a patient comes down that's on any of these Tier 2 precautions, that you're aware that they're coming. They should not be sitting in the holding area. These patients should be going directly into the MRI suite, getting their scan, and taken right back to their room. They should not be sitting in the hallway or the holding area for any extended amount of time. You don't want to run the risk of them infecting other patients. As I touched on earlier, sometimes it's necessary to isolate patients who have some types of infections. Sometimes it's necessary to isolate patients in rooms that have specific circulation procedures. Negative pressure isolation rooms are going to maintain a flow of air into the room, thus keeping contaminants and pathogens from reaching surrounding areas. The most common application in the health industry today is for patients with TB. They should be in these negative pressure isolation rooms. The TB is being infected with TB is very high risk, and these rooms are essential to protect healthcare workers and other patients. So anybody that has TB should be isolated in a special negative pressure isolation room. Oh, one thing that I forgot, sometimes patients are put in a positive pressure isolation room. Positive pressure isolation rooms maintain a flow of air out of the room, thus protecting the patient from possible contaminants and other pathogens which might otherwise enter. So patients that are in positive pressure isolation rooms will be patients that are very immunocompromised, maybe someone that's just gotten some kind of procedure done, or like a cancer patient that has a very, very low immune system, you want them to be in a positive pressure isolation room because you want to maintain a flow of air out of the room, protecting the patient. Whereas the negative pressure isolation room maintains a flow of air into the room, keeping those germs in the room and not letting them out to surrounding areas. So I hope I clarified that okay. 2 types of isolation rooms. Like I touched on before, sometimes it's going to be necessary for these patients who are on isolation to come down to the department. If it's necessary to transport a patient with an infectious disease, the patient should be wearing the mask during the transport. So most importantly, we want to make sure that we protect ourselves. So as soon as we're done taking care of these patients, we need to wash our hands immediately with soap and water before and after we're in contact with them. Like I said, when the patient arrives in the department, they go right into the room. You always want to protect your table with a sheet or some kind of table paper if you have it. You should always work with a partner, so one partner handles the patient and the other would handle the equipment. You always want to place any kind of contaminated linens in the proper container, and after the patient is returned to their bed, the wheelchair or stretcher or whatever we transported the patient in should be wiped down thoroughly. Some more common sense stuff. Never recap any needles, and any needles or sharps need to be put in the appropriate puncture resistant containers. We've all seen these containers. Typically they're red. They have a filled line on them, so you want to make sure that these containers are not filled above the fill line. Once containers reach the fill line, you should shut them up, put them in to be in the wherever needles and sharps are picked up through environmental services. You should put them in that area and put a new container in the room. Obviously, we should all do our share of cleaning, routine cleaning and disinfecting surfaces and beds, and the couches for the MRI machine should be wiped down in between every patient. Bed rails, patient exam tables, bedside tables, anything that may be used in the transport of that patient to the department should be wiped down. Linen should be put in the proper linen container, especially if they're contaminated or soiled with blood and body fluids. They shouldn't go in the regular blue linen bags. They should be put in a red bag. Okay, unfortunately, accidents will happen in the clinical setting, so if for some reason you are accidentally stuck with a needle, you need to immediately wash the exposed area with soap and water, and you should report your needle stick to the faculty at the clinical site. The clinical site will have their own guidelines about what needs to be done next if you need to be seen by employee health there or a physician. And always, always, always you need to report any kind of incidents to the program office. So just to recap, things that you should review what microorganisms are. You should review the cycle of infection, what nosocomial infections are, and iatrogenic infections. You need to review personal protective equipment and when it should be used. So all of these things need to be reviewed prior to your quiz for the week. And as always, everything in the infection control chapter in your patient care book is fair game, so please review and read those chapters in your book.